79-year-old male with 1-day history of back pain and breathlessness. Okay. CT scan of the chest and the abdomen showing this lesion. Yes, right-sided, retroperitoneal, soft tissue density with fat stranding. Right-sided retroperitoneal soft tissue density with fat stranding. Okay. This lesion is seen compressing the inferior vena cava. So this is the compressed inferior vena cava by this lesion. And this is the left renal vein that is draining into the compressed inferior vena cava. If you go up, this is the compressed inferior vena cava. This lesion is most likely to arise from the right adrenal gland because it is seen superior to the renal, superior to the right kidney. Okay. And this is the normal left adrenal gland. This is the normal left adrenal gland. And this is the lesion that is expected to arise from the right adrenal gland. The chest cut showing bilateral pleural plaques. This is a calcified pleural plaque. If you go to the left, another calcified pleural plaque. Okay. If you go here, yes, there is another calcified pleural plaque. Okay. This calcified pleural plaque is associated with a pleural-based oval-shaped enhancing lesion with underlying pleural thickening and overlying comet tail sign. Okay, so this lesion represents parenchymal collapse. Okay, that's why it shows the parenchymal enhancement. The comet tail sign the comet tail sign represents pulling of the adjacent bronchovascular bundle into the collapsed lung. Okay. This lesion is seen in the posterior part of the right lower lung lobe and associated with volume loss in that lobe. This lesion is most likely to be round atelectasis or benign folded lung. There is a right upper lobe speculated mass. This mass is associated with enlarged right hilar lymph node, along with prominent right paratracheal lymph node. Again, but in the mediastinal window. This is the right upper lung lobe speculated mass. And here This is the enlarged right hilar lymph node. And if you go up, you will see the prominent right paratracheal lymph node. So this lesion is most likely to be lung malignancy. There is another irregular lung nodule in the left upper lung lobe, this one, okay. This is the nodule. This lesion could be a second primary malignancy, or possibly a metastasis from the right-sided malignancy. Could be a metastasis from the right-sided primary malignancy. Next finding, atheromatous aorta. Okay, so the aorta here shows wall atheroma. Okay, and if you go down, here's the wall atheroma within the aorta, all of these. Okay, then the aorta will bifurcate into the two common iliac arteries, okay, with atheroma. Then each common iliac artery will divide into external iliac artery and the internal iliac artery. The external iliac artery will supply the leg, the internal iliac artery will supply the pelvic organs, okay? So here this is the right external iliac artery and its vein, okay? The right external iliac artery will be seen occluded here, okay? So focus. Yeah, here. This is the occluded right external iliac artery. The occluded right external iliac artery just beyond its origin, okay? Its origin from the right common iliac artery. Again, this is the right external iliac artery, started to be occluded here. This is the normal left external iliac artery. And after that, yeah, occlusion. Yeah, here there's complete occlusion of the right external iliac artery. Next finding, early sigmoid diverticular disease. This is a plate, and this is the early sigmoid diverticular disease, air containing out pouching, air containing out pouching, seen in the wall of the sigmoid colon. All of these are early sigmoid diverticular disease. So the interpretation here, this patient has calcified pleural plaques along with pleural thickening and round atelectasis or benign folded lung. Okay, all of these findings could be due to asbestosis, and this patient is most probably has a past history of asbestos exposure. And as you know, asbestosis increases the risk for developing lung cancer, and this patient has a speculated mass in the right upper lung lobe along with enlarged right hilar and right paratracheal, enlarged right hilar and the right paratracheal lymph node, and the enlarged right paratracheal lymph node. So this lesion is most likely to be a primary lung malignancy. A primary lung malignancy with the irregular nodule. The irregular nodule in the left upper lung lobe is most likely to be either a second primary malignancy, a second or a contralateral synchronous malignancy, a contralateral synchronous primary malignancy, or a contralateral metastatic deposit from the right-sided primary malignancy. And the right-sided soft tissue density that is surrounded by fat stranding that is seen within the right adrenal gland is most likely to be an adrenal metastatic deposit from the right-sided lung cancer. This is a metastatic deposit with acute hemorrhage. Acute hemorrhage into a right adrenal metastatic deposit from the primary lung cancer. So the diagnosis here, primary lung cancer with acute hemorrhage into an adrenal metastatic deposit. Management of this patient. This patient needs urgent chest clinic referral concerning the lung malignancy. So this patient needs to be referred urgently to the chest clinic, and I would recommend discussion at lung cancer MDT. Okay, and concerning the right adrenal hemorrhage, this patient needs urgent surgical referral for surgical review concerning the right adrenal hemorrhage. That's it.